वो है कि
Good morning. I'm Akanksha and my moderator is Dr. Asma ma'am. The topic of my presentation is behavioral addiction. What is behavioral addiction? There are several behaviors besides psychoactive substance ingestion which produce short-term reward in our brain that may result in persistence of these behaviors. The person may repeat these behaviors for the feeling of that high, you can say, uh, which, uh, which he get by those behaviors. So these behaviors are continued despite the individual's understanding and awareness of the adverse consequences. That's why these are known as behavioral addictions. Generally, we know addiction generally the term addiction is used for substance addiction. Behavioral addiction is a relatively new term in psychiatry. So we will discuss some similarities to the substance addiction. The similarities are failure to resist. The individual will have the failure to resist to act on that particular way. There is salience. Salience means the individual prioritized that behavior among all other activities. He may skip his meals to use internet, to use smartphones. Next is mood modification. That particular activity will give that an individual such experience that he will feel some kind of adrenal rush. He will try to escape the reality and he will like those experiences. There is tolerance. The individual will seek more time and he will, with time, he will try to indulge more in that behavior to get those mood modifications. And there are associated withdrawal symptoms. If you'll try to stop the individual from doing those activities, you can see there are specific mood changes, depression, restlessness is seen in the individual. There are conflicts with their family, friends, with their daily activities, social life, work, and these kind of conflicts are also seen in substance addiction. Relapse is also seen. After a period of control, the individual will fall into those patterns again and again. Some other similarities are seen in the etiology of substance addiction and behavioral addiction. Those are genetic makeup, individual, psychosocial, and sociological factors. Object exposure and object interaction, like the substance addiction, affect the behavioral addiction. Like substance addiction, there are high rates of behavioral addiction in adolescents and young adults. The neurobiological antecedents, like there are similar pleasure neurocircuitry seen in MRI studies of both kind of addictions. There is coexistence of behavioral addiction and substance addiction. For example, alcohol use disorder and gambling are mostly associated together. Other comorbidities associated with both kind of addictions are antisocial personality disorder, depression, attention deficit hyperactivity disorders, and bipolar disorders. There are seen treatment similarities among both of addictions. There are evidence of efficacy of antidepressant in both substance use disorder and gambling disorder. Naltrexone is used in opioid abuse disorders and has shown efficacy in treatment of pathological gambling also. What is different from substance addiction is these behavioral addictions are not associated with any kind of psychoactive substance intake. The withdrawal symptoms in behavioral addiction is less acute than that of substance addiction. Abstinence is not possible or ideal for some kind of behavioral addiction. For example, work addiction, exercise addiction, food addiction, sex addiction, and internet use disorders. Some examples of behavioral addiction are gambling disorder, gaming disorder, internet use disorder, shopping addiction, work addiction, exercise addiction, relationship addiction. We'll be discussing a little bit about these disorders. Gambling disorder is seen in types of lottery card, poker games, card games, and wagering on sports, etc. More prevalence of gambling disorder is seen among males. There is intense urge and frequent repetitive episodes despite of adverse consequences. These consequences are putting them in large debts and putting their job at risk. But these disorders are due to seeking of easy money, escaping the problems and reality, and relieving a dysphoric mood. The person can even commit illegal acts to finance the gambling. Internet disorders. There is seen increasing tolerance of among internet disorders, psychological dependency, withdrawal is also seen. Use of internet is mostly seen for coping up with the negative mood and reducing the stress. There are adverse consequences, and there are also comorbidities like depression and substance use disorders. Gaming addiction are more seen among children and adolescents. This is also for escaping the reality and satisfying sense of mastery and achievement. Satisfying sense of mastery is said in the sense that the particular game and the particular character you are in that game could master the game, and you have that sense of mastery which you are avoiding in real life. There is impaired control, increased tolerance, withdrawal, and other adverse consequences which are physical, mental, and financial. Some games have that have that money, have that uh, uh, terms of investing money in them. So there are financial issues also. There are some violent games which are associated with aggressive behavior of the individual. Food addiction is a type of addiction. There are recurrent binge eating episodes and loss of control. More seen for the hyperpalatable foods which are high in fat and high in sugar. Continue despite negative consequences. Relapse is seen. And comorbidities are anxiety disorders and attention deficit hyperactivity disorders. Sexual addiction. There is failure to resist the impulse, and there is the desire to stop or control is overruled. Increasing time spent over such websites. Continued despite adverse consequences. Comorbidities seen with sexual addiction are substance use disorders, attention deficit hyperactivity disorder, and mood disorders. There is multiple approach for the treatment of behavioral disorders. Most appropriate and acceptable is for the time is cognitive behavioral therapy along with motivational enhancement and support groups. Pharmacotherapy is more used for the comorbidities and the underlying conditions and the consequences of these addictions. My references is clinical practice guidelines on newer and emerging addictive disorders in India, published by Indian Psychiatric Society, and an article on behavioral addictions, excessive gambling, gaming, internet, and smartphone use among children and adolescents. Thank you.
Good morning. Today I am presenting a topic of my presentation, PTSD, which is post-traumatic stress disorder, along with its clinical feature and diagnosis, by moderator Ms. Dr. Aditi. First of all, we talk about what is PTSD. PTSD, basically post-traumatic stress disorder that follows following exposure to an extremely threatening or horrific event that is characterized by all of the following events: First, re-experiencing the traumatic event or event in the present in the form of vivid intrusive memories, flashbacks, or nightmares. Second, avoidance of thoughts and memories of the event. Third, persistent perceptions of heightened current threat. This, following other traumatic events that can lead to PTSD also. Now, there is some clear CNS mediations of PTSD along with its clinical manifestations, how it occurs. Several brain circuits have been implied in the mediations of PTSD. Clinical manifestations, those includes are fear learning, emotion regulation, executive control, contextual learning. Now, let's briefly talk about CNS mediation, how it occurs. Basically, CNS mediations occur along with its fear conditional theory. Basically, in this model, there is an operates executions or maintenance of PTSD symptoms, which consolidations and consolidation of conditions for responses. In the CNS circuits involved after long living, CNS circuits induced in fear conditions along with its fear conditioning and extend rare adaptive learning processes. Stress response system include parasympathetic, sympathetic systems activation, cardiovascular and respiratory reactions, which activate the hypothalamus pituitary axis, which activate defensive fight, flight, and behavior, which changes the information processing. This is modulated by the central nucleus of the brain, which is mainly through amygdala. During the exposure of threat, previous neutral stress response overlap in time with stress threat stimuli, which pass through the thalamus to basolateral nucleus of amygdala, which activates central nucleus. This contributes to overgeneralization of threat stimuli, psychotherapeutic treatment, which currently condition stimulus. Now, the clinical features of PTSD. Those pupils were extremely painful, utterly uncontrollable, fending threat, intrusive thinking, recall and reappraisal of traumatic experiences, self-protection, adequate attention to existing stressors. Now, some predisposing factors in PTSD. First, presence of childhood trauma. Second, borderline paranoid dependent or antisocial personality disorder traits. Inadequate family or peer support system, being a female. Fourth, genetic vulnerability to psychiatric illness, recent stressful life changes, recent excessive alcohol intake. Now, the diagnostic criteria of PTSD along with its DSM-5, ICD-10, and ICD-11. Now, duration. In DSM-5, the diagnostic criteria of PTSD is more than 1 month. In ICD-10, the symptoms arise in weeks, months following each trauma event. In ICD-11, symptoms persist for at least several weeks. Symptoms: history of exposure to actual threatened death, severe injury, or sexual trauma. Intrusive symptoms also occur in like involuntary intrusive memory. In children less than 6 years of age, may see reenactment of event through play, recurrent nightmares or dreams of the event. In children less than 6 years of age, frightening dreaming without identifiable content may be present. Dissociative responses or reliving of prior experiences, like in children less than 6 years of age, may see reenactment of event through play. Psychological distress related to exposure to stimuli that are reminders of prior trauma. Patterns of avoidance of similar associated with prior experience of trauma, like avoidance of memories related to trauma, avoidance of external reminders of trauma. Some other symptoms are negative mood or cognitions related to trauma. First, impairment in memories related to event, negative perceptions of self and others, cognitive distortions related to event, excessive guilt, anger, and fear, diminished interest and social withdrawal, subjective detachment from others, altered level of arousal like irritability, risk-taking, hypervigilance, increased startle response, difficulties with concentration, sleep disturbances. In ICD-10, the symptoms are as follows. Traumatic event would distress.
I would still like to know there is some basic more or less symptoms of fever. They don't put much about it. Doesn't mean that you're telling that duration might be a bit different. But are you sure that I see 10 and 11 there is no specific duration? I would like to think that you're not you're told in DSM 1 month, but I think 1 month मिला था.
तो DSM 5 में मिला था, उनमें नहीं मिला, मतलब 1 वीक का ट्रॉमा के बाद के लिखा था. Now, the psychological consequences of symptoms in DSM-5: marked distress and impairment in functioning, exclusions, exposure through media, electronic, movie, or photo related to substance use. Symptom specifiers in DSM-5 with dissociative symptoms, depersonalization, and derealization. Course specifiers or diagnostic criteria not met until 6 months or more after initial traumatic event. Now, the treatment for PTSD, it occurs in two ways: pharmacological treatment and psychotherapeutic treatment. In pharmacological treatment, SSRIs are given, SNRIs, atypical antipsychotics, anticonvulsants, prazosin and trazodone are given for specific symptoms. Like prazosin are given for nightmares and trazodone are given for insomnia patients. Psychotherapeutic treatment, trauma-focused cognitive behavior therapy, TFCBT, and PET, which is prolonged exposure therapy. Both therapy occur through re-expensive traumatic event through repetitively engaging with behavior. In CPT, which is cognitive processing therapy, in CPT, basically faulty attributions, including post-traumatic overgeneralizations, occurs. In PCT, present past-centered therapy occurs, which involves current relationships and work challenges rather than trauma. Psychodynamic psychotherapy, group and family therapy. Now, the differential diagnosis of post-traumatic stress disorder. Medical causes: traumatic brain injury, epilepsy, alcohol use disorder, substance-related disorders, acute substances or alcohol withdrawal. Psychiatric diagnosis: panic disorder, generalized anxiety disorder, major depressive disorder, dissociative identity disorder, borderline personality disorder, acute stress disorder. These are my references.
Anxiety. Don't find it. It's very commonly occurring in one of the public sector. Psychotherapy, there is not technical outdated, but remembering the new of it, that's something. Fine. So both of those were very good. I would like to ask that sexual action were in one slide. Okay. Now think about this. Newly two persons in a new relationship. He married, the female partner comes and tells the doctor, this guy is sexually addicted, that he has intercourse 8 to 9 times per day, and I am totally fed up. Okay, but would you consider that sexual addiction? If not, why? That's sexual addiction. Even with the partner also, but you can ask the female partner. Because this is not a particular substance you what is it? It's a behavior
Duration.
duration of intercourse.
Sorry, so from the
Maybe
behavior.
it is there, like even the girls before that have similar problems. That this guy performs say 9 times per day.
So other than the behavior, we can see the other kind of activities like internet and browsing. And if he's always thinking about that,
The meaning to say about the preoccupation. Right? Now the thing is, many guys mind the preoccupied with sex. Can't help that. Okay. Even girls are, but they don't tell. Okay. But the thing is that you have to see the dysfunction. That in a new relationship, having intercourse for now, everyone doesn't have the same sexual appetite as another person. Someone might feel that this is fine, and the person who has a less appetite will this is more. Okay, and he will feel that this is less. This girl doesn't have any interest about she's frigid. The guy must also mind this girl is frigid, doesn't have any interest, doesn't do anything. Okay, so it is about the difference of level. Sexual topic is very complicated. Sometimes people tell it to be compulsive declaration. Sometimes people tell it to be an offset of OCD. Okay. But thing is that often it might be normal. Might not be actually does the difference in preferences. Now addiction will tell quality of addiction will come from preoccupation to the level of activities also. Neglect of other activities. That would come. That would come. And he would be neglecting his other things, the job and all these things. Very difficult, very difficult. I pointed out this thing. This term has actually not been there in any diagnostic criteria as per now. Okay. Gambling disorder is there. Okay. Even shopping also sometimes they come, but still not fine. So this is one area where there are overlaps. Okay. So take it some of contrasting evidence. Verify the other interns verify from their graduates. Yeah. It is in the ICT, what is the subjects? One maybe 1 month, 1 month, 3 months. Isn't it? Same हो सकते हैं. Human addiction का जो
अगर somebody will stop for 3 months continuously, that will go mania से
डिफरेंशियल लगेगा ना लेकिन जो भी बात होती है मेरे पास एक पेशेंट इसको आई था वो उसकी लड़की को लेके आई थी उसको दिखा पर्सनैलिटी पे फॉलो का मॉडल but when interviewing her about this episode and what but the other things are actually there. Now I thought you guys were going for the interview was so much of time after the start of the only way to talk to had that not तो वो जो बाकी जो मूड वगैरह ओवरथिंकिंग वो सब होता है सिर्फ वो शॉपिंग करने से तो इम्पल्स का भी मतलब क्वालिटी आ रहा है, क्वालिटी। एडिक्शन में दो मॉडल्स होते हैं ना, कंपल्सिविटी एंड इम्पल्सिविटी। ये पढ़ना पड़ेगा। कंपल्सिविटी में क्या होता है, जो मैं बोल रहा था, impaired responsibility इनिबिलिटी कर पाते हैं। एग्जैक्टली वो कारण से इम्पल्सिव कर पाते हैं। हाँ, वो इम्पल्स है कंटिन्यूस, आपको क्या वो दुनिया में भी होता है, लेकिन अदर फीचर्स में सिर्फ हुआ ये शॉपिंग का बेसिस का जो मतलब क्या इम्पल्स बेसिकली मैं कंपल्सन का इम्पल्स को अगर मैं एक चीज